So my name is Eva Slowacki. I'm the Interim Executive Director of the Canadian Association for Global Health. And I'm welcoming you here to our policy dialogues, and which are our presenters are going to be joining us remotely. But I'd like to start by acknowledging each of the Indigenous nations whose traditional and unceded territory we are gathered upon from our various locations. Here in Ottawa, where CAGH is based, I want to acknowledge that we are on the unceded territory of the Algonquin Anishinaabe Nation. So this SDG Policy Dialogue Series is supported by Employment Social Development Canada, and we are grateful for their contribution to this dialogue series. In addition to the people that are at this conference, we will have people from outside of the conference joining us by Zoom. So a bigger audience, or different than just the people at the conference. So the Policy Dialogue Series is focused on the intersection of health and the climate emergency. Seeing that climate change is one of global health's most significant challenges, we are designing and delivering a series of dialogues to explore the implications of this relationship, specifically to better understand the breadth and depth of the impacts, to strengthen awareness and interest amongst diverse communities, to explore the effectiveness of current approaches that aim to acknowledge this relationship and address impacts. We want to identify progressive ways forward that can enhance adaptation capacities and mitigation, and to make sure that we all know how we can engage in this space to get involved with these activities and support progress. We held our first dialogue in October of this year on climate change and mental health. And today we are presenting two dialogues during this conference. The dialogues are focused on shaping of co-benefit policymaking, which is now, that's one of the first dialogues we're presenting today. And at 1 p.m. today, there will be a look at Canada's National Agenda 2030 and the factors influencing the federal uptake of the SDGs. So I encourage everyone who's interested in SDGs to join both. So in addition to our esteemed speakers, our dialogue will be captured through graphic recording with Jordana Globerman. Wait, well, where is she? Not there, okay. Yeah. All right, and for the Q&A part of so I don't know if you've seen the graphic recordings, but they're really cool. They shall capture the discussion as we're going on in a lovely infographic, which we'll use to summarize the dialogue and will be shared afterwards. Oh, there it is. Well, that's the start. So for the Q&A part of the program, we encourage you to share your questions for our panelists. Our in-person guests in this room here can just step up to the microphone. The others that are joining on Whova through the conference app can add their questions there. And those who are on the Zoom platform can enter their questions in the chat. So now I'm going to introduce our event moderator, Andre Picard. He moderated the first policy dialogue last month, and we're happy to have him join for the second, just to see how the dialogue is progressing. He is one of Canada's top health and public policy observers and commentators. He has been a health reporter and columnist for the Globe and Mail, and is also an 8-time nominee for the National Newspaper Awards, Canada's top journalism prize, and past winner of the prestigious Michener Award for meritorious public service journalism. He was named Canada's first public health hero by the Canadian Public Health Association, as a champion of mental health by the Canadian Alliance on Mental Illness and Mental Health. He received the Queen Elizabeth II Diamond Jubilee Medal for his dedication to improving healthcare. And in 2020, Andre was awarded the Owen Adams Award of Honor, the highest CMA award available to a non-physician. Before I welcome Andre back, I just want to acknowledge the team that put this event together, and that is here to follow up with you on any conversations related to SDGs. And that would be Amara Khan back there. Yeah, and Jessica Helwig, who's doing the back scenes work, the work behind the scenes to keep things going smoothly, more smoothly than my speech. I'm sorry. So right now, welcome back, Andre, and we're pleased to have you again with us again to facilitate this important dialogue.
Great, thank you, Eva. It's great to be back at the SDG policy dialogue on climate change and public health. As you heard in this series, we're discussing how to shape and implement meaningful policies to address health implications of climate change, which is probably the single biggest health challenge going forward for this generation and the next. So a big issue. Last month in our first dialogue, we focused on the relationship between climate change and mental health, the impact all these worries are having on our minds and our lives. And if you missed that session, it was a very interesting session. If you missed it, it's on the Canadian Association for Global Health YouTube channel, so you can watch that, but please wait until you hear this panel and then you can go listen to that one later. Now today, in our second in the series, this is happening now in the wake of COP26 in Glasgow. We're going to focus more on the challenges of policymaking, from problem conceptualization to design, implementation, and evaluation. So a little more geekish than the last one, but really important stuff. How do we achieve adaptation goals that take into account the health and well-being of people, and also the socio-ecological environment? These are big challenges from a policymaking perspective. With the help of our great panelists, we're going to tackle some big issues on this topic: the state of climate change and health research, the value and importance of data, the importance of systems thinking, ecological knowledge systems, health in all policies, stakeholder engagements. We're going to hear a little bit about all those things today. And the ultimate goal here, of course, is to build climate resilient health systems and policies, not just on paper, but in practice. So you're going to get a lot of practical tips today that you can take and apply in your daily work and advocacy, hopefully. Now, format is pretty straightforward. We all have spent a lot of time on Zoom. Some of you have the benefit of being live, which is a new thing. I hope you're enjoying that. But we're going to have a straightforward format. Each of our panelists will speak briefly. I'll ask a few follow-up questions, but I'm going to put most of the pressure on you in the audience to get some good questions, and I'm going to incorporate them into our discussion. As you heard, you can put them in the chat function if you're with us online, or if you're in person, please use the Whova app, and I'll be monitoring both of those and try and get as many questions in as possible. So let me dive right into it, because we have some great speakers, and I'll introduce our first speaker. I'll ask Dr. Sherilee Harper to turn on her camera so we can see her. She's the Canada Research Chair in Climate Change and Health, and Associate Professor in the School of Public Health at the University of Alberta as well. Her research investigates associations between weather, environment, and health in the context of climate change. Among her many publications, Dr. Harper is the lead author of the Intergovernmental Panel on Climate Change Special Report on Ocean and Cryosphere in a Changing Climate. So Dr. Harper, welcome. The virtual floor is yours for the next few minutes.
Thank you so much. I'm just going to share my screen. It's such an honor to be here today to talk about climate change and health. It's such a critical topic, and I've been really looking forward to today for a while now. It's also a really huge honor to be joining you from Treaty 6 territory today in Edmonton, Alberta. So I've been tasked with sort of setting the stage about, talking about the state of climate change and health research right now in Canada and abroad. So to do that, I'd like to sort of give a little bit of context. We all know that climate change is a really hot topic right now, and it's been really interesting to see the huge increase in climate change coverage in the media over the past few years, and most recently on CBC. CBC a few weeks ago, just before COP26 actually, they had made a statement that they're going to have a renewed dedicated coverage on climate change topics. And I think that we certainly saw that at COP26. Whether you were in Glasgow or not, you were able to follow along what those climate change negotiations were talking about and what that meant for all of us. And one really interesting thing about COP26 was the elevation of the topic of health. It was the first time at a COP that there was a health pavilion there. And so health was taking more of a center stage in these negotiations than they have in past years. And so if we need to frame climate change as a health topic, then an important question becomes, well, what do we know about climate change impacts on health, and what's the state of research? How can research inform how we frame climate change as a health issue? And we certainly know that climate change impacts health. Changes, increases in temperature results in things like heat waves, changes in precipitation results in, some of the devastating floods that we've seen in British Columbia most recently. And that all makes changes in the environment, including things like wildfire conditions and increases the intensity, duration, and occurrence of wildfires. And all of those things act through the social determinants of health to impact our health. And the health impacts, of course, are very, broad and wide-ranging, and they vary from things like, morbidity during heat waves to different infectious diseases like foodborne diseases or waterborne diseases, but also things like mental health, which was just talked about a few minutes ago. I mean, all of these things impact our mental health and wellness as well. And so in terms of the state of science on this topic, we did a systematic literature review recently that looked at the state of climate change and health research in North America specifically. And we looked at the state of research since the last IPCC report, the last report, the fifth assessment report. And what I want to do now is just share some of the 3 high-level findings that we found based on this literature review. The first finding is that we know the least about the locations that are experiencing the biggest climate change impacts. And so you can see on this map, most of the work was done in the United States. The United States definitely dominates climate change and health research in North America, but also globally. And we saw very little research published from Mexico. And we also saw less in Canada as well. But we also see less research within countries in particularly vulnerable areas or hotspots of climate change. So for example, in Canada, we know that some of the biggest impacts of climate change are in the Canadian Arctic. The Canadian Arctic is experiencing some of the fastest rates of warming in the entire world, but we know very little about how those climate change impacts are impacting the health of the people who live there. The second major finding is that there are critical knowledge gaps. We know most about things like, how morbidity and mortality increases during heat waves, but we know relatively little about things like how climate change is impacting mental health or how climate change is impacting foodborne disease. And so there's huge content gaps in terms of health outcomes. And there's also huge content gaps in terms of futures. So we know a lot, most of the research has been conducted about how climate change has already impacted our health. Like looking back the past couple of decades, there's been a lot of research that has looked at how climate change has impacted our health in the past couple of decades. There's relatively little research that looks forward and says, okay, if climate change is occurring under these different climate change scenarios, how will the health effects of climate change differ under those different climate change scenarios? This is an emerging area of research, but we still know relatively little about that. The third major finding was that we know relatively little about what climate health responses are the best. Most of the research, as you can see in this graph, focuses on climate change impacts, so how climate change has impacted health. There was hardly any research that looked at what mitigation or adaptation strategies had the best health outcomes. So if we were going to respond during heat waves or during floods or during wildfires, what interventions or what public health practice is the best at promoting and protecting health? Well, we know relatively little about that. And these are our major knowledge gaps. And you might be wondering, well, like, why does that matter? I think that one thing that COVID has made very clear is that it's really important to be making evidence-based decisions in the health sector, For sure. I think we all can agree on that. And this information is obviously really important to inform public health practice, to inform what we do like on the ground in terms of public health response. But there's also really important implications for these gaps in research in terms of international policy. So I'd like to now return back to this conversation of COP and thinking about how COP26 has been really trying to frame climate change as a health issue and talk about the implications for the research gaps in terms of that. So the IPCC, the Intergovernmental Panel on Climate Change, is the UN body that produces these state of knowledge reports on climate change. These are critical documents because all of the UN member states sign off on them. So when the reports are released, it means that all the different countries have agreed to the underlying science in the reports and say, yes, we agree that this is the state of knowledge on the topic. We agree that we have to take these things into consideration in our decision making. And these are the reports that underline or underpin the negotiations that happen at the UN COPs. So in Glasgow, most recently, the most recent IPCC reports were discussed during the negotiations when they were talking, about phase out or reducing coal, and when they were talking about loss and damage. When different countries were negotiating this, they were basing this on these IPCC reports. And the IPCC reports are based on published literature. So IPCC can only discuss or talk about or assess research that's been published in peer review articles, and to a lesser extent, the gray literature. And so if this information is missing in the peer review literature or in the gray literature, it means that it's missing in the IPCC reports, and it's not included in really important international policy arenas like COP26. So I will end it there, and I'm really looking forward to the discussion. Thanks so much.
Great. Thank you very much for Dr. Harper that was a great presentation. As a writer, I really appreciated your opening line, a nice pun that climate change is a hot topic, but it definitely is, despite the wordplay. So I appreciated that. And I think I heard, and our audience probably heard, a lot of researchers are in the audience. There's a lot of opportunity here. So it's not all bad news. There's a lot to be done. And we'll have some questions for you about that in a little while after we hear from the others. So thank you very much for kicking us off. Next, I would like to introduce Dr. Horatio Arruda. He's Quebec's National Director of Public Health and Assistant Deputy Minister in the province. He's an expert in public health and preventive medicine with a focus on epidemiology and infection control. He's a well-known figure during COVID, but we're going to give him a break from talking about that today. I should mention too that Dr. Arruda does a lot of work internationally beyond COVID, and including as the chairperson of the Global Network for Health in All Policies. So Dr. Arruda, thank you for joining us. The floor is yours.
Thank you. It's a pleasure, and I thank you for the invitation. I'm sorry I don't have any PowerPoint, so you will have to tolerate my face. I'm sorry, but I just want to say that this month is the goal of the month of the SDGs is 13 climate action. And I just want to tell you that even if you have seen me a lot in the aspect of the epidemic of COVID-19, I always wear my 17 objectives of the Sustainable Development Goals to remember me that there is other issue, there is a terrible epidemic actually going on, but there is a lot of problems with also climate change, poverty, inequalities of health. So I think it's always important to remember it. And as a public health actor, it's my role to take the best information from research, from best practices, and try to make it going from the speech to action. And I just wanted to present to you some things that have been done for you. So thanks for this invitation. It's great exactly to not talking just only from COVID-19. Yesterday I was in a group works on mental health. I think that's another epidemic that is there. So I would like briefly to propose 4 topics as seeds for discussion during the forthcoming panel. First, a brief review of the main principles of the Health in All Policies approach. Then some thought on climate change in Quebec. Thirdly, I will see why is Health in All Policies approach pertinent to tackle climate issues. And finally, the challenge we are faced with this post-pandemic period. I just want to say you that we often have the criticism in governments to be working in silos, you know, everybody having his own strategy by ministry, going down in the field where everybody received those strategies. And I think that the approach in health and all policies is a collaborative approach that integrates and articulates health consideration into policymaking across sectors. And this is all to improve health in all communities and people. The health in all policies approach may be effective in identifying gaps in evidence, so where we can finance the research and achieving health equity. I just want to say to you that health in all policies approach gives at least the place for at the high level of getting into a win-win situation when actions by the Ministry of Environment or actions from the Ministry of Agriculture combined with the ones we can do in health will have a better impact when we have limited resources. And at least if we have defined together what are the actions that we can collaborate in a win-win situation. Actions across sectors have always been the heart of public health intervention. It's clear. However, in 2016, Quebec government has given a new impetus to these efforts by adopting an integrating health prevention policy that reached out a spectrum of stakeholders. We call it the governmental health prevention policy. I just want to say that it's not a miracle. We still are working on that. And I would say working on that from one government to another one, because since the beginning, this approach has been retained by all the governments, but that's all I can say. A challenge, very important challenge, and the financing of those approaches is one too. This policy aims at acting upon a combination of factors with the objective of improving health and quality of life of the population, and by the same token, reducing social inequality of health. The overall context into which the population is evolving has a decisive influence on his health. You know it, the determinants of health are very interesting. Amongst the big issues of particular interest, there is the climate change because of the sustainability of its effect on the actual and future generations. I think there is climate change skeptic people as there is vaccine skeptic people, but I think what we see actually, there is big problems around the world, just what is happening actually in BC. I think we cannot, I hope, now think it doesn't exist. Therefore, creativity amidst the fight against climate change will contribute without a doubt in reducing social inequities in health. During this panel, I can offer you some examples of the latter. Secondly, the Quebec and Health Social Services Network has been active for more than 2 decades regarding low-knowledge development. I think it's very important. Our first presenter explained why research is important, what we know, what we don't know. And we did it concerning climate change and its impact, as well as implementations of different adaptation measures. The government has created, I would say, Uranos, which is a consortium of people from universities, from the different ministries, and we finance different studies to help, I would say, the government to take decisions, financing research on public health and adaptation and climate change and zoonosis, for example. And I think this knowledge is very important and active as a base to try to take good decisions. And there is more and more, I would say, asking people from the municipalities at the local level to Uranos to try to have what are the best actions people can do for not changing the world. I think this is at other levels as the COP is there, but how we can at least adapt or change the environmental place in the municipality to help against those issues. As an example, since the mid-2000s, a specific funding program is dedicated to the fight against climate change. Originally called Le Fonds Vert, the Green Fund, it is known now as the Electrification and Climate Change Fund. During the panel, I will offer some details, if you want, about this fund and the actions that have been permitted. Thirdly, considering the much common ground between many adaptation measures and municipalities against atmospheric health effects and the improvement on physical and mental health on city dwellers, there's measures have become priorities in some municipalities. For example, urban greening programs that change, I would say, parking lots, which were very not interesting, putting them green, having places for the community to come together. And there is even for, I would say, the physical health issues related to heat waves, it is good also for the community and social networking for, I would say, populations which are more vulnerable. There is all kinds of examples of promotion active transportation, local field management of rainfalls, and trying to do some air pollution control. These measures not only contribute to the creation of environmental favorable to health, but also contribute to the reduction of greenhouse gas emission at this low level and the adaptation to climate change impact. The governmental health prevention policy helps putting in place several actions that provide leverage for the coordination of the latter and the local and regional levels, thus supporting the fight against climate change. As an example, already known by many of you, health impact assessment is a process which allows municipal stakeholders to better consider potential health effects of projects in their planning stage on a population and foresee the necessary adjustments on the recommendation at the early stage of the project. We know that when we do work with the population and take into account, I would say, the impacts of acceptability, social acceptability of a project, this is important and to do by the beginning. I would say that most of the situations when we didn't take care of this approach could even stop very big projects. I can give you some examples later about this. If I ask you against the background of climate change, how can health in our policies approach health? I think the COVID-19 pandemic shows us the important it is for Quebec, and I would say for everywhere, to reinforce health and social services system capacities, to maintain efforts in protecting the health of our population in response to the present threats. Climate change jeopardizes the health of our population, considering its effects on determinants of health. And it's not only a physical aspect, there is mental health issues, there is economic thing, there is a lot of problems. We know how devastating can be a flood and when your own security and your home is attacked. So I think it's important. And it calls this thing to reinforce national, regional, local collaboration across sectors in between ministries and our politics of governmental prevention. There is 15 ministries and provincial people who transform this policy into an action plan. We are working actually in the second phase of our action plan. We received $20 million for that policy, but I think it's not enough, and we will try to at least give the deliverables from our first action plan and continue to really try to give our authorities and municipalities the tools that will help them and continuing to finance research to really see how we can approach, I would say, that challenge at the local, regional, and national place. So it's a pleasure for me to be here with experts, with people from the research. As a public health person, I will do my best to try to make things go from speech to action and never forget this. For me, it's important. Thanks.
Merci beaucoup, Dr. Arruda. Thank you very much, Dr. Arruda, for that. We lost your image for a little bit there, but we had the opportunity to see Jordana in action doing the live drawing of the that she's preparing for us, and we'll look at that in a little more detail later. But that was a nice opportunity for us to see how that works. And I'm glad to see that she has not drawn me as Santa Claus yet, but that's still a danger. We still have some time, so I'll watch.
Sorry for the loss of the image, but I think that probably what you see is more beautiful than my face, so it's great, no problem.
It was nice to have a mix of both. I'll take the opportunity to remind people you can ask questions in the chat function. You can do it on Whova, et vous êtes évidemment bienvenue de demander des questions, faire des commentaires en français, et on peut faire la traduction en passant. Now, next up on our panel is Dr. David Zakas. He's the founding editor and publisher of Planetary Health Weekly, founding director of the Center for International Health at the University of Toronto, and he has a long career in teaching and research at a number of universities. He's also worked in at least 45 countries around the world as a member of Canadian Physicians for Aid and Relief. So, Dr. Zakas, the virtual floor is yours.
Thank you very much, Andre. I'll just share my screen, but just to say how great the previous presentations were, and thank you very much, Dr. Harper and Dr. Arruda. Those were very excellent. I shall just share here. So we know that there is a need to act. This is just so clear in everything we've heard today, everything that we've read, and then followed in the COP26 process and previous years of different declarations and everything, and also observing what's going on around us. And so the climate crisis and the effects on health are just apparent to us in just about every walk of life, and everyone is being affected. So today I'm going to carry on the theme of the intersection of health and climate emergency, and talking about policies and talking about how we can make sure that the policies that are developed are truly representative of what's going on and what is needed. And I'm going to take an approach on this, kind of like a stakeholders analysis approach. So the climate crisis and the biodiversity loss, which go hand in hand and cannot be really separated one from the other, affects everyone. And what is needed now is a major transformation, almost a revolution. I had the great privilege of attending the second week of the COP26 in Glasgow, and it became very, very clear to me that we need a revolution in the way we think, the way we act, and the way our governments work. And so otherwise we're not going to get there. Therefore, almost everyone somehow should contribute and be part of the decision-making process and action, part of policy-making and implementation. But who is this everyone? Who are the major stakeholders? Who can impact the climate crisis? And also, what do they do to aggravate the climate crisis? Because we're all involved in that too. And it's important to identify them and get a comprehensive picture. So stakeholders, that is to say everyone involved, can be found in every level of society, right from the global, regional, national, subnational, city. It does appear that in Canada anyway, that the subnational, especially after hearing Dr. Arruda's presentation from Quebec, what he reports is just truly fantastic. And at the municipal level too, is where action really needs to take place, and where communities and neighborhoods can then become involved, as well as families and individuals. So it goes all the way from global perspectives and multinational corporations, multilateral organizations, right down to you and I as individuals in society, and what can we do? Often when we think of leadership and the stakeholders, we think of governments. And this really was what was presented to us at COP26. It was a gathering, and a very inspirational gathering, of 197 nations from around the world coming together. And here we can see our Canadian representative, Minister Stephen Guilbeault, speaking here at the conference. He also was on the panel of the very first session I attended. And I put a picture of that onto the Planetary Health Weekly this last week, because what we need to do is also we need to be communicating more and talking to people more about what's going on, learning more and communicating more. So leadership policy action, and all sector collaboration. This is really what it's all about. The one message that I took away from COP is that there were so many sectors of society that weren't represented there. It was mainly a conference of politicians and some lobbyists, mostly under the guise of nations like Saudi Arabia and Qatar and others. But there were also, as was mentioned already by Dr. Harper, that there was also a health pavilion. And I was really struck by these pavilions. There were pavilions from many countries of the world, not Canada. Canada did not have a pavilion. The only mention of Canada in the pavilion area was a representation by one person that I met from the Canadian Nuclear Association. And that was all that we saw from Canada there. But nonetheless, so leadership takes place, and we saw it in action at COP26 and even at the IPCC at the global level, multilateral organization level, World Health Organization, World Bank, all kinds of multilateral organizations, including the United, and then also these exceptional documents and conventions like the United Nations Framework Convention on Climate Change. These are the global policies that are helping to shape the nation as we go forward. And so it's no doubt that governments have a very strong role, also the private sector, the business sector, philanthropy. There is such a huge role for the media, and it was a very interesting experience there to see the media from all over the world reporting on what's going on, but also to involve those who are involved in marketing, because they're the ones who in many ways are thought leaders and help to lead us into where we're headed for. Of course, civil society, mostly at the conference, was on the outside of the conference, at the gates as one entered, including environmental justice leaders, non-governmental organizations, many different types of aid agencies. Indigenous peoples is so important that we listen to their voice, that their voice be part of the decision-making process. This was mentioned very clearly by John Kerry in one of his interventions about the importance of the Indigenous people's voice in the establishment of policy and action going forward. The education sector and academia and all the research sectors, of course, they have a huge role to play and a big voice to be heard. And you know, it's no secret that about half of the university organizations that belong to the Canadian Association for Global Health have not divested their endowment funds from fossil fuel industries. About half have, the different 19 universities that are members. And so there is a great work for us yet to do in that area. And sports heroes, entertainment figures, arts, the people who are presenting, even like drawing us today and as we present. Many people follow these people more than anybody else. If LeBron James says something about climate change, wow, watch out. Or some other very famous person in the entertainment. There was, you know, rumors of different movie stars being at the conference. I didn't see any, but religious organizations. This is so important. People have a very strong connections to their religious organizations. And when those leaders speak out, people do listen, and it's so very important. The military has a huge stake in all of this. If for nothing else, then their navies are situated on coastal areas and cities where the sea level rise is having huge effects on their installations and many other things taking place. The military is declared climate change as a national security threat in the United States. Farmers, I didn't meet or hear of any farmer or any really persons connected to growing food at the conference. And this is a big issue because the farmers are the ones who are really impacted by climate change. They're the ones who enable us in cities, especially as our cities grow, to have a life. We don't grow our food, we have to get it from our farmers. So the youth, it's so important that we listen to our youth. They're the ones who are full of ideas, and it is their world they're going to be taking over from all the failures of my generation and others. The youth voice was very strong, again, outside of the conference. It did gain some strength when the delegation from Panama invited youth delegates to come in and be part of their delegation and speak. So that was a very interesting thing that just happened on the spur of the moment in the last couple of days. aristocracy. You know, we really don't think of that too much when we see them on tabloids, but Prince Charles was addressing the G20 conference on climate change just before the COP26 conference. There are some aristocrats who have a lot of power and can really help to shape things as well and be influenced over what people think. Unions, of course, as representative of workers all over the world, very important, and including truck drivers. I just added this on at the last minute because when I was thinking about food and how we get our food, and the fact that we're having all these supply chain problems right now, and it's because of, in many ways, a lack of truck drivers, and that there's even like upwards of 1 million truck drivers in the United States. And I'm not sure how many in Canada. We could say 100,000, but this is also a very important. So there are so many sectors involved in this, and there are so many voices that need to be heard because they are being impacted, and they also are impacting the climate change. I just like to end on this. One of the things that was very interesting for me to attend was this Beyond Oil and Gas Alliance. And I couldn't have been more happy and more pleased when I learned and met afterwards the climate change ambassador from the province of Quebec. Quebec joined this along with several other nations to make a commitment to phase out oil and gas production and align with the Paris Agreement goals. I went up to him afterwards and as I said, as a Canadian, I thank you very, very much for doing this on behalf of Canada as well. Canada didn't join, but Quebec did. And again, super kudos to Quebec for helping to lead the way in our country about things that are needed. Aid agencies, and I'll just end on this, they talked about, and as did the developing countries, the need for finance, the need for money, the need for their ability to adapt and mitigate the impacts of the climate change, which is being caused by the richer countries of the world. And previous to the conference, I was always just in the mode of talking about mitigation and adaptation. But at the conference, I learned that everybody talking about mitigation and adaptation was also including finance after that. And so that's, it's part of mitigation, of course, part of adaptation, but it seems to have gained its own single entity and entry in our thinking. So this all going on as there's a pandemic, we have two super large global issues to deal with at the same time. One immediately killing many, many millions of people, the other doing it more slowly, but still having a tremendous impact. So thank you very much.
Great, thank you very much, Dr. Zachas. Gave us a lot to think about. I see it's generating some questions and discussion, so that will be great. People will have some good questions for you coming up. So I'd like to introduce our final panelist, last but not least, of course, almost Dr. Melanie Goodchild, a systems thinking scholar who's currently a PhD candidate in social ecological sustainability at the University of Waterloo. That's why I'm calling her almost doctor, so almost done her PhD. She's also a research fellow with the Waterloo Institute for Social Innovation and Resilience. Melanie is Anishinaabe Ojibwe from the Moose Clan of the Big Tigong Nishnabeg Kitagosibi First Nations. Excuse my pronunciation there, Melanie. She is a faculty member of the Wolf Willow Institute for Systems Learning and founder of the Turtle Island Institute. So thank you. The virtual floor is yours.
Miigwech. So to the translators, I'm going to be speaking in Anishinaabe Mowin to follow the cultural protocols of how I introduce myself. So Bojo and Dinawamaganaduk, that's greetings to you, all of my relatives. Wabshke o Gitchada Kwe Zanang Indigenous Cause, Waba Anang Kwe Indigenous Cause. Those are my two spirit names, how I'm known in the spirit world. Moose and Dodem, that's my Dodemic, my clan is Moose Clan. Bigtagong Nishnabeg and Donjaba, Kitagonzibi and Donjaba. Those are the two First Nations I'm from. And Anishinaabe Kwe Anda, so I'm Anishinaabe, also known as Ojibwe, Chippewa, and Saulteaux in different areas. And I'm here in my home. You're joining me at my dining room table, and I live near Niagara Falls, the place of the Thundering Waters in Ontario. And so this is traditional Haudenosaunee Confederacy territory and the Three Fires Confederacy. So the Three Fires are the Anishinaabe, which is where my background comes from, the Odawa and the Potawatomi. And so today I wanted to share with you, thinking about health and thinking about policy in particular from an Anishinaabe Gikindasuan perspective, which is our original ways of knowing, and Indamawin, our ancient wisdom, is how we might translate that. I wanted to share a couple of things about some of the work I'm doing in systems and complexity. So I'm a systems and complexity scholar. And I think Indigenous knowledges around the world are natural systems thinkers. And when we think about systems, it's really about irreducible wholeness. And there was a recognition coming out of Western science, medicine, of the scientific method, that there's more than the parts, that, the sort of decoupling of humanity from nature, for example, the compartmentalization of knowledge was doing us a disservice as human beings. And so I wanted to share with you about what I've found in studying and speaking with climate scientists and Indigenous elders. I wrote an article called Relational Systems Thinking. That's how change is going to come from our Earth Mother. And in that article, it was published in earlier this year in the inaugural issue of the Journal of Awareness-Based Systems Change, which is a new journal from the Presencing Institute at MIT. And I co-wrote that paper with 4 Haudenosaunee elders, Dr. Dan Longboat, Diane Longboat, Rick Hill, and Kevin Deere, and also with 2 systems thinkers, Peter Senge, who wrote a book called The Fifth Discipline, and my colleague Otto Scharmer, both at MIT. And we study systems, but from an Anishinaabe perspective, I had to decode what Western systems thinking and conventional systems thinking had to offer. And in that decoding, I've developed kind of a framework. And so when we talk about the perspective of Anishinaabe people, Anishinaabe meaning Indigenous peoples, certainly we know that Indigenous peoples are at the forefront of experiencing the impact of climate change, that it's affecting our health from a spiritual, mental, physical, and emotional perspective. And for us, when we think about health, the biomedical model often defines health or well-being as the absence of disease. But from an Anishinaabe perspective, it's the presence of balance. It's the balance of the mental, spiritual, physical, and emotional. And so the anthropocentric bias of a lot of the climate science, and I think some of the health science is very human focused. And so from an Anishinaabe perspective, we don't really have the same value system where human beings are presented as the top of the pyramid of creation. In fact, we don't have a word in Anishinaabe for nature, for environment, biosphere. We say, I asked a speaker, a language speaker once, and he said, we say, Gidakimanan. Gidakimanan means everything, everything in creation, the sun, the moon, the stars, the wind, the trees, the water, the animals, and human beings, and our sacred place in creation. So that's what linguists call a hollow phrase. We call it a word bundle. And that translation of Gidakimanan is an ethics. It's an ethics around how we are in relationship with the natural world. So I'm going to share my screen. I've got a few minutes here to share with you a model that came out of the article. And the article is about something called relational systems thinking. It's going to move this and give you a full screen. So relational systems thinking, like I mentioned, conventional systems thinking really looks at irreducible wholeness. It looks at feedback loops. We use tools like systems mapping, sensing into systems, sense making, planting the seeds for systemic transformation. We talk about things like scale and perspective, path dependencies, why do things continue as they are, especially when they produce undesirable outcomes. And so there are system archetypes that we map out. But what I found is that in studying this, I had to go back to the elders and ask them to redefine some of the tenets or the postulates of systems thinking as a theory. And so I spoke to the Haudenosaunee elders, and this is the original treaty. This is the wampum belt in the middle, the Geswenta. The wampum belt was a treaty between the Haudenosaunee Confederacy, back then called mistakenly the Iroquois Confederacy, and the Dutch, and eventually the French and the British. In that original treaty, You'll see there those sacred wampum shells. That's the river of life. Those white beads are the river of life. And there was an understanding from the Haudenosaunee people, the Mohawk people, and the people of the Six Nations that this was a time where different peoples were coming together and we would share the river of life together. Those two columns in the middle that are purple represent the Dutch merchant sailing ship in the Iroquois birch bark canoe. So I wrote the paper in a 2-row visual code with Peter and Otto sharing their teachings, with the elders sharing their stories and teachings. And I realized that they were saying the same thing, but just from different worldviews. And so this mental model of anthropocentrism is really difficult to challenge when we have languages like English, for example, that refer to the natural world as nouns, you know, a tree or a lake or a mountain as an it, as a thing. Whereas in Anishinaabemowin, our language, those beings are referred to as living. They have animacy. So there's a sentient being. So I mentioned I'm near Niagara Falls and I'm near Lake Erie. Those are beings. And those are in Dinawamaganaduk, all of my relations. So this, if you can't tell, is also, this model is a wampum belt here. There's 3 columns. So there's the river of life in the background. The 2 columns on the left and right, we could put any sort of, distinct worldviews. You could have science of the humanities. You could have different types of teachings on either side. And so on this side, on the right side, I have Anishinaabe Mino Bumatsawin, the good life, our natural law as Anishinaabe people. On the left, I have systems thinking science, going right back to Aristotle, coming through to a number of scholars who address irreducible wholeness like Gestalt and those types of teachings in Gaia. And in there, we have all kinds of tools. In the middle, Arkan Lashwala, who's an elder from Peru, he suggests that rather than choosing sides, we look at the sacred space between. And Cree scholar Willie Ermine talks about ethical space when he talked about the different legal systems coming together, the Canadian legal system and his nation's legal system. And so the Churro Wampum Belt is a central metaphor, but really it's a way to shift consciousness. And I'm sort of referring to this in a new article that's coming out as a dynamic interface theoretical living model. So it's evolving for reasoning in the sacred space between ways of knowing. And I'll just wrap up and stop sharing my screen to say that when it comes to policies, if we continue to use language like ancestral medicine from Chinese people or from indigenous peoples as alternative medicine, if we continue to develop policies that don't shift and address the mental models that got us into this predicament in the first place, then we're not really addressing, I think, some of the fundamental issues that are causing climate change. And that would be a good place to start. And that really focuses on healing. We've been really disconnected from our Earth Mother for many different reasons, but particularly industrialization and settler colonialism has shifted how we are in relationship. You know, what season is it? Where's our food coming from? We go in our grocery stores and just kind of assume everything's going to be there without, really thinking about what's in season. So I think I will stop there and thank you very much for your attention. Thank you, Andre, for hosting us and the other panelists, and thank you for the invitation to speak with you today. So I'll say that we often talk about the what of bringing in Indigenous perspectives, and that model was to help us think about the how. So thank you for listening.
Thank you very much, Dr. Goodchild, Chimigwech, for your presentation. Very thoughtful, and we look forward to, there's some questions rolling in for you. So I want to thank all the panelists for their insight. We're going to bring you all on screen in a second, but before we do that, we want to take a quick look again at the graphic recording of the dialogue so far. So we're going to get Jordana's drawing up on the screen here so you can take a look. Those of you in the room can run up and look closer, but those of us can see it very nicely online. Thank you. So you see how she's summarized much better than I do as a journalist in nice graphics what's going on, and has not given me quite enough hair, but otherwise everything looks really interesting. So we'll see that again a little later. So I'll invite all the panelists to turn their cameras back on, and we'll start into some questions. As I mentioned before, I'm going to ask a couple of questions I'm going to take my privilege as a moderator, ask some questions of the panelists, and then I'm going to wade into a lot of them that I've been trying to summarize on Whova and in the chat, and try and incorporate those, as many as possible, into the discussion. So I want to start, if I could, Dr. Harper, with you. You mentioned in your talk there are a lot of knowledge gaps that came over, a lot of research needs to be done. Could you point out where are the biggest gaps? What are the urgent ones that we really have to tackle now?
I think there are two, and I think that they intersect actually. One is that we know a lot about what's already happened, but we don't have a good sense of the range of things that could happen in the future. And I think that this past summer's heat dome really illustrated that. We had known for a while now that climate change has been increasing the intensity, the frequency, and the magnitude of heat waves. But what this past summer showed us was just the amount of increase in intensity that we could actually see with climate change. And so we have a good sense of what's happened in the past, but not such a good sense of the range of types of things we might see in the future and how our health system can prepare for that. The second thing is, we don't understand fully the range of solutions that are available to protect health in those situations. And so, what adaptation strategies are most effective for who, in what context, that type of research is really in its infancy. And again, the research that has been done on that topic tends to look at the past, what's worked well in the past. And I think that we need to start looking forward into the future and say, okay, under these range of climate change scenarios, which adaptation strategies will be most effective moving forward. We have a better sense of what's worked in the past, but we have less of a sense of what's going to work well in service in the future.
Great. And I just want to read out one of the comments. There's a lot of good comments, but one is saying, thank you all for sharing your work and knowledge. I'm feeling inspired to continue this work. So very inspirational talks. Dr. Goodchild, I wonder if I could jump to you as a complexity researcher. I know I've heard some complexity research speak before. They make this distinction between complexity and complicated. Climate change, is that complicated, or is it complex, or is it both?
Yeah, thank you. Yeah, so there's a beautiful framework that a colleague of mine, David Snowden, put forward called the Cynefin framework, which is Welsh, that word Cynefin, and he talks about simple, complicated, complex, and chaos. And so a colleague of mine as well, Dr. Francis Wesley, talked about the distinctions. And so simple is baking a cake. So there's a recipe, and if we follow it, hopefully it's going to turn out like it should. Complicated is sending a rocket to the moon. It's a little bit harder, but there's a recipe, and if we follow, the rules, it's certainly not easy, but we should be able to do it, and we've done it repeatedly. Complex is raising children. That's the analogy. There's no handbook, and no matter what we do, what's going to happen, and then there's chaos. So complexity and complicated. I think climate change, because we talk about feedback loops, these system archetypes I mentioned, what's happening is in complex adaptive systems, they're nonlinear. And so they come out and surprise us with, what they're doing. We can plan and we can run all kinds of scenarios. And I think that's what a lot of system scholars do. But from an Anishinaabe perspective, the complexity is actually about Dr. Leroy Littlebear, who's Blackfoot, an elder that I've had beautiful conversations with about complexity. From his perspective, what we try to do often is assume that there's an underlying order to these big intractable issues, whereas really the theoretical physicists understand the Blackfoot teachings of flux, that really there's constant change in flux. And as soon as we recognize that, the quantum potential, for example, we will have, I think, a better time handling those different polarities. And so a complexity mindset is kind of what, and there's a certain level of readiness. I think that's why it starts with inner healing, to really be able to handle the complexity of things, which means that there's multiple entry points or leverage points, and climate change is one of those intractable issues that's going to require so many different actors doing so many different things. And it behooves us, as my Uncle Dan says, because the river of life itself is now in danger, to work together and bring in all of those different ways of knowing and being, and not just compartmentalize everything and silo our work that we, I'll often say, where are the dance choreographers and the artists as part of these conversations, because they'll just bring such a beautiful perspective to miigwech.
And Dr. Zakas, someone who's been doing this for a long time, influencing policy change, being an advocate, is that complex? Is it complicated? Is it chaos? Is it all of them? How do you do it most effectively?
I think it's not. I think it's, it's just the old phrase, just do it. I think that's the bottom line. I would just like to mention too about the science of climate change. Oftentimes people come to me and say, oh, wow, it's so complicated and so difficult to understand how, and I don't understand why it's happening. Why is climate warming happening? And when I explain it, it just literally takes 2 minutes about incoming radiation and outgoing radiation and the absorption by the CO2 and the heating up of the molecules in the air. It is so easy to understand. I believe that high school children can easily understand it. And I'd just like to pick up on the same question, though, something that Dr. Harper said about we really have very little understanding of what other people are doing around the world. And there is so much happening and so much innovation going on and so much research happening, and we really don't know about it. And so we feel that it is so complex and we don't know what to do, but other people are doing lots of things. And I'll just say, when I started the Planetary Health Weekly 7 years ago, when I was at Ryerson, I involved a number of students, and we had a student active action group. And they came to me and said, oh, we don't want to keep hearing about all the problems that are going to take place in the future. We want to focus on what we can do. And so I think that's a little bit of a dilemma, because if we do have research about what is going to happen in the future, it's not looking good. Honestly, from all signs, it does not look good. And from what we're seeing now in British Columbia, Atlantic Canada, et cetera, all over the world, it's just going to get worse and worse. And the things that we are experiencing now, we're probably already locked into the atmosphere many years ago. We don't know, I don't think exactly, but what we're seeing now is not the result of carbon emissions yesterday. It was carbon emissions a decade ago or whatever. And then I'm also just so appreciative to hear again from Dr. Arruda about what Quebec is doing. I think the other provinces, we need to wake up. Just this morning, it was announced by the Auditor General in Ontario that Ontario is barely going to reach 20% of its climate change goals if we continue on as we are. And there is no indication that we're not going to carry on as we are. That's the big problem. And I think that, and so the complexity and the complicatedness, of course, is there. And I think that one page that I had of all the different stakeholders, that's complicated. How do you deal with all those people? But at the end of the day, we all have to, I think, I'm not a revolutionary or anything, but we all have to do something. And we all have to at least get our voice out there, and even if it's a vote, and tell people what we're thinking, and as communities and as provinces and whatever.
And Dr. Arruda, maybe you can build on that. You work a lot with government, with politicians. What do they listen to? What influences them? Are they open to things like health in all policies more than we think?
They are, but I would say the most important thing is what the population is asking for. Politicians want to get, they want the admissions. They are good guys. They are not as bad as everybody says. They want to change things, but there is rules. And I would say that I think it's very important that the population realize, and there is a need, even if everybody learn about it, the impact of that is going to happen. It's exactly like prevention of infectious disease. Now, everybody's talking about the fact that we didn't invest enough, but we were telling that 10 years ago, So I think there is a need. The people must also ask not only for healthcare, but also for giving to the youth. And I think I was very happy to listen to you, Dr. Zakas, about the youth. They are the ones, we are playing with their heritage, and we have the right to give them something that they will be able to do. And I think I want to say to you too, that we must work in a win-win situation. When we do a EAT program for transforming parkings to, I would say, green spaces, and have even food over there. There is, you know, vulnerable people live in places where the heat is very important, where there is no food, fresh food, actually. And you can even have short effects, positive things to the community, even if it's going to help also for I would say, the climate change. And I do think that there is no small project that will not contribute to that. Being in a project makes a community understand things, making them empowered to do the difference. And I think we must invest with the youth. And I think the best thing is probably to explain that it's what I always have did for COVID-19, because I want to be asked what it is, to explain, because there is no enough people who understand about sustainable development goals. It's incredible how much I think that even in my healthcare, people around, even in public health, people are not aware of this. So I think it's very important that it comes a leitmotif, and even when we work one project, there is 4 or 5 objectives that are over there. So I think that's, I'm trying to make them fear of they're going to be in a big problem, and even the other projects could not happen. The healthcare system will not be sustainable if we are in crisis about climate change. So that's, but I think the best thing to do is to put the problem into the media, discuss, ask the population to ask for change.
Great. Just before I ask the next question, I want to, in passing, I want to apologize to Dr. Goodchild. I mispronounced your first name, Mullany. I have it in my notes, and I don't know why I read it wrong. So sorry about that. I'll get it right at the end again. So Dr. Harper, another question for you has come in. People are asking, what is contributing to these knowledge gaps and this research scarcity? Is it just lack of money? Is it a lack of political commitment? What's the underlying problem for this?
Well, that is a really good question, because I don't think we fully know the answer to it. I think that there are a number of things. I think one is absolutely money and funding structures. Climate change is an interdisciplinary issue. It requires a lot of different disciplines to come together, and the funding structure in Canada for research is, 3 main councils: social science, natural sciences, and health sciences. And to really have a well-integrated climate change project, those funding agencies need to come together, or there needs to be some sort of structure that more than one discipline can come together to work on these problems. So funding is definitely one. The other is education. I mean, we're talking about youth, and youth are demanding education on climate change, and we're seriously lacking on it across Canada. There's been a number of research projects that have actually looked at this and documented it, not just in Canada, but around the world. Youth are hungry for this, they want it, and it just isn't available yet. So I think that another piece of it is education and training the future climate change and health leaders of tomorrow.
Great. And Dr. Zakas, a couple of questions related. I'm going to smunch them together, try and make sense of them. People are asking, governments, essentially government policies created this problem, created climate change. How do you work with them to fix it? Is that just not doable? If they've created the problem, can they actually fix it? And how can you be effective in translating your asks into policy, to making them act?
Right. I think it's important that we demand that there be a variety of stakeholders at the table with government. I think that that's really, really important. Canadians have relative trust in government, but it's really, it's getting shaky. And COVID, look at the backlash against immunization, for instance. It's just, but I think that we really do need to push forward in actually asking government, what are the plans? Not what are the ambitions, not what are the pledges, not what are the commitments, of which I heard over and over again in Glasgow, but where is your action plan? When I teach management, is what I've taught for many, many years, health management, you go through your goals, objectives, strategies, and then action plan. So once we have We don't even have our strategies defined yet. You know, we know that we must get off of fossil fuels. We must stop coal tomorrow. We must begin to wind down our oil and gas industries. It's a must. But yet there's no discussion even at the government level about that. I don't hear anything. And so we have to discuss it, but we have to actually lay out plans. What is the 5-year plan? If we're making commitments by 2023 for getting rid of methane, as Canada signed on to, where, you know, we can wait. We're still waiting. That just happened a week ago or so. But where is the actual plan? And how can Canadians be involved? I think that that's really important too. How can citizens be involved in whatever government proposes? Because it has to have, as Dr. Ruda said, it has to have the backing of all the people. Politicians respond to voters.
And there's some comments in the chat about that. Ordinary people have to care about this to make it change. So that's a good point. Dr. Goodchild, a couple of questions for you two, which I'm going to sponge together. People are asking, how can we reconcile Western and Indigenous approaches to tackling climate change? And related to this, you know, you talked about how language matters. How can we change that language so that it's more reflects what you said, the respect for the earth, etc.?
Language, and it's okay about the mispronunciation of my name, named after my dad Delaney and my mom Melinda, and they halved it up and spelled it like Melanie. So I've been correcting teachers for many years. And in terms of, you know, and I'm also not a doctor, so you were right. I'm a PhD candidate.
I said almost doctor at the introduction, but I've given you my blessing.
Thank you. Yes, thank you very much. So I'm a doctor today. Yeah, in terms of reconciling the different worldviews, the distinct worldviews, you know, when I talked about that sacred space in between, it's doing things from a place of humility, love, and compassion is challenging because, you know, we're under a time crunch. And so there's a real focus on action, which I think is really important. But in terms of Anishinaabe, Gik, and Daswin, there's also the process. You know, who are you asking? Are you asking the ancestors? So we live in a time of prophecy. And so while people will have heard of the Anthropocene or the Anthropocene and can debate sort of that as a geological epoch, the anthropogenic, you know, behavior, is not in a sense a relationship with kin. And so if we were to look at being in relationship with the natural world as a kinship system, then that language that I talked about really is encoded in there, that relationship with the land. And so for us, for example, knowledge is not something that resides in here and is intellectual that you possess and you have your, you know, your PhD and what have you. It actually resides on the land and is revealed through personal experiences on the land. And so the bringing in of some of those languages, other languages into English documents, I think is really key. And I'll just share very quickly. When I was writing my comprehensive exam, which is a 10,000 word essay about traditional ecological knowledge, which I was critiquing as a compartmentalization of a holistic knowledge system, I talked to some elders and I said, well, there's a definition of resilience, and it's the C.S. Hollings, the capacity of a system to absorb a shock and not flip into something unrecognizable, like when a lake dies. I said, how would we say that? And two different elders got back to me and said, one said we'd say Sibiskagad, which is a river flowing flexibly through the land. And that was Renee Mishaki. And then Eleanor Skeed back home in Wajuskanagam, my sister, said, it's Mamasinjige, which is the quick twists and turns of the water going through the land. And so our cosmology and epistemology, so our worldview is encoded in land-based teachings. And I think the more that we're in dialogue, and as others have said, that you have Indigenous peoples with local knowledge, elders who are sharing those stories. And it's really a process of storytelling. And the process is so important. The Aboriginal people in Australia talk about yarning. And I've had yarns with them. And it's a different thing than a dialogue and a debate. It's respectful and it's welcoming stories that bring your whole knowledge system to a place of authenticity, and that's called Minagojawin, your sacred knowledge bundle. And so if you open a container like this and you invite everybody's sacred knowledge bundle to be present, it's very different than what's your name, what's your title, and here's 5 minutes on a panel. And I think the more that we do those types of Indigenous-based methodologies and relational methodologies, we will be able to learn from each other much more in these times, especially. So, miigwech, thank you for listening.
Dr. Arruda, a number of people in the chat have noted Quebec is a leader, at least in Canada, on climate change, doing a little more. They're asking if you could give some practical examples of how health in all policies are applied, and how they could be done elsewhere in other provinces.
I would say that Quebec is not perfect. There is a lot of work to do yet. But I'm trying to put the research and the theory into action at a local level, because, even if we get big policies, there must be some change in the field. So there is different kinds of projects. There has been, first of all, financing research through, I would say, Uranos, who is making projections on what can happen later, but also trying to get best data. There's been a program for adaptation of the healthcare, and also what could be the mitigations approach that can be done. There has been a lot of programs trying to have some projects who will change the local environmental with greening spaces, lowering, I would say, the heat places in the city, and making the environmental around even better, because I know I'm living in Quebec City in a, I would say, poor place, and there has been a lot of change of different spaces, very small spots in where people can sit, talk, socialize. Even there is food over there, there is tomatoes, and people can pick up. So there is this short-term aspects, but a movement to understand that. And this is the kind, and there is different projects that have been financed. We've been working in a share with MAPAC, which is the agriculture one, and the health for zoonosis, an observatory on zoonosis, looking to Zika, to West Nile, to Lyme disease, and see the emerging impacts of this in biodiversity. We've done different projects in municipalities. Almost, there is also, because of climate change, more allergens. Actually, a program for municipalities to take away the pollens, and we have demonstrated the reduce of use of antihistaminics in the population. That's small projects. It won't change the world, but it makes the movement and permit to put into action locally, give to the people the power, and I think it's very important. But that is part of the, I would say, of, for me, what is important is to have the impression that we do something. We get this policy of health in all policies and political governmental prevention. There is action plan. And I think it's important to, in between three ministers, to say, this is the action we're going to do by this time, and at least be doing something. Because if we only talk and there is no action, people won't believe us anymore. We will lose the confidence of the population. So even if and there is not enough money, I can tell you we got 20 million for that. I hope we would have 1,000 millions and make sure that we do projects. But they're the same thing. Sometimes we ask for money, and the money, we cannot spend it for all kinds of reasons. There is no resources, and no, there's a problem, human resources. There is a problem of, and I think it's important. And it's very important to have an approach where those intersectorial programs can be financed even for research, and not working in silos, because that's a problem. And having a more holistic approach for that, and I would say a win-win situation that makes that the Ministry of Environmental, the Ministry of Transport, and the Ministry of Health are going to be happy to do that project with funds coming from everywhere. And because we work together, we are not working with different objectives. We are going to the same strength. And I think it's important that the river goes straight, even if sometimes you have to go that way. That's the case. But I think that's important, and to have that vision and share it. And it takes years. You know, it takes years, and people change also. You have to come back to the next deputy minister to explain what has been done before. But I think it's important. And being as a an actor of public health, I have that role, but even as a citizen too. So I think that's that it's not perfect at all, I can tell you, but we are trying to do it, and we count, and I hope that we won't wait big crisis over the world to do something, because that's always the problem. We react on what we see. And I think we must talk about what we're seeing. We must have people with mental health problems related to what happened to them to take the talk and explain that this could happen to you.
Okay. Dr. Zakas, another couple of questions on this topic. You mentioned civil society was outside the gates at COP26. They weren't at the table. People are wondering, is that having an influence? The Greta Thunbergs of the world, people protesting, is that actually changing policy, or are we just blowing off steam?
I believe in it fully, just to say. I also believe that those at the outside of the gates in Glasgow had a huge impact, because the media was there 24 hours a day filming them and showing their pictures around the world. And I'm a big fan of Greta Thunberg, I'll tell you. She's created a movement that now spans like 150 countries, the Fridays for Future. And that's truly remarkable. And she's rallying the young people, and they're angry. They're seeing all the gobbledygook that's being spoken and all the blah, 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 you know. I mean, I don't want to overemphasize that, but, you know, she really hits the nail on the head, I'll tell you. And so I do think that there is a huge role for civil society. There are so many excellent groups like Équiterre in Quebec, Climate Home News and David Suzuki Foundation, et cetera, et cetera. There's just so many groups. It's hard to keep track of everything, but it's good when people come together, because we know through organization theory that you get things done by working together with other people. You know, as a single person, sure, you can do a lot, but when you get together with another person and another person and another person, you will have impact. And I do believe that people listen to Greta. I know that I have some scholarly friends in the United Kingdom, and they're thrilled by what she was saying and listening to her. And it's remarkable for, I think she's 17 years old or whatever. She's and the other youth leaders that were there, and the people from the Amazon, and all of the indigenous groups that were there. I met people from Guatemala and Brazil, and those are the voices. These are the people who it's really affecting too. And as you were saying, we must listen to the people who are being affected, either physical, mental, or social issues.
Great. And I'm getting a text from a Swedish-speaking friend correcting me, saying I should be saying Greta Thunberg. So I will correct that. We have we've got to work on this language. It's a never evolving thing. So we only have a couple of minutes left. I always like to, I make it a policy, especially during COVID, to try and always end a panel on a very positive note. So I want to ask each of you briefly to just tell us what's giving you hope that we're going to be able to tackle this. It sometimes feels overwhelming. We can feel nihilistic about climate change, but what's making you hopeful these days that we're going to make some progress? Dr. Harper, I'll start with you. You started us off today. You look like a very hopeful person, so it's off.
And I'm going to build on what David said, because I have dedicated my career to climate change and health from the very beginning. So I've been doing really focusing on this topic since 2006, and that's all I do. And I have to say that things have changed a lot since then, and things have particularly changed in the past 3 years. And I think personally, I don't have any data to support this, but my personal opinion is that that's because of what the youth are doing. They are bringing this conversation to the table, and they're making climate change not just an election issue, which it has become since they've started doing this, but they've made it an everyday issue, and they're holding people accountable to it. And I was also at COP26 in Glasgow in person, and I have to say that the most moving and inspiring piece for me there was on the day of action, and seeing literally thousands and thousands and thousands of youth on the streets about this topic. I mean, I honestly sat there and I was moved to tears because they care so much about this topic and they're moving it forward in such an amazing way that we have been unable to do to date. So I mean, that gives me so much hope. And I think now it's our job to respond. And then the last thing I'll say is that I love how one of the things that the youth are asking us to do is listen to the science. They're like, that's what Greta is saying. She's saying, look at these IPCC reports. How can you not be alarmed? How can you not be taking action? And so they're really basing a lot of their calls to action on science, which is also really inspiring to see.
Dr. Arruda, briefly, what makes you hopeful?
Two things. The youth, because they're going to do better than we did. And they are convinced, and I think it's the next generation. And the other one is that when there is an emergency, people get together and act. The only thing I hope is that we won't wait too late for that emergency. But I think that people must understand the threat, very important threat. And I think that the youth understand them. And now we have to act, because we cannot say afterwards, we didn't knew about it. Nobody told us. And I think that this is the way to it. Youth is for me, is the light. And I would say that emergency makes people get together, because it's a global threat. And we have to be rich countries that created all that change. Now there is the poor ones who are living with the consequences, which is terrible.
Great, thank you. David Zakas, you've been at this a long time. What keeps you hopeful?
Well, I totally agree with the two previous about the youth and about the position of science. And I'll just step out on the limb a little by saying this. I do have hope because of the research and reading that I do for my newsletter. I read about a lot of emerging technologies and research that is going on around the world. Even modeling that's coming out of India on how to use solar panels more efficiently in communities and in cities. In China, there's all kinds of research going on, and yet we're antagonistic against them and whatever. But I do think that there is a lot of science and research that is taking place around the world, and a lot of funding that is being put towards it. I know that President Biden has just committed multiples of billions of dollars to more research in these areas. I'm not a person who believes in a technological answer, because it won't come, I don't think. But I do think, though, that we will be aided by better technologies in the very near future. But there needs to be a war room where all these different disciplines of ministries can come together and integrate, and the funding mechanisms too. And I think the other thing that does give me hope is that here in Canada, we can speak out, we can talk, we can say whatever we want, and we can move things forward.
Great, thank you. And the final word, Melanie Goodchild, I'll give you the final word on this one.
Thank you. Yeah, well, I think I started talking about balance, and so maybe this is the balance. While I also agree about the power and potential of young people and youth. My niece is Autumn Peltier, a water commissioner who's been speaking about and for the water since she was quite young. The elders, when Thomas Bianca, a Hopi elder, went to the House of Micah, which was the United Nations in 1992, leading up to the Rio Summit, he spoke almost to an empty house, and he spoke about the Hopi prophecies. And so a lot of our elders are passing on. We're losing an encyclopedia, if you want to call it that, every time we lose an elder. And so from that perspective, the teaching of balance, when I first started doing my work, I was offered some spirit helpers, a turtle rattle, a Mikinak Shishigwin, and an eagle feather, a Migaze Miguan, in addition to my personal medicine bundle. And both of those are teachings about heart and mind and balancing those. And I think that's where my greatest hope comes from. And I'll just wrap up saying that the disenchantment of the world that came out of the Enlightenment, it's actually Europeans that I spend a lot of time with, and people all over the world who felt that. And then I was talking to a scholar who is from Croatia, grew up in Cleveland, Ohio, and is teaching in Switzerland. And she said her grandmother talked about the water sprites and talked about the energy of the forest, but that was dismissed, paganism or as something inappropriate and unrational or irrational, sorry. So I think that for me, the hope is the balance of the rational mind, which is if you don't see those beings and those spirit helpers, then how rational are you being? From our perspective, it's quite irrational to not see them and engage with them. So asking our ancestors to help us is a huge part of this. And it gives me a lot of hope that more and more people are committing to learning about their ancestry from all over the world, because we're all indigenous to Mother Earth. So miigwech.
Right. And again, thank you to all the panelists. Merci, Chi Miigwech, to all the panelists for your insight and really thoughtful commentary. I hope the audience has found the session really informative and insightful, at least as much as I have. We've tried to provide some practical information on influencing, crafting public policy, which I hope you can apply in your daily work. I've retained a few little things that really jumped out at me. Melanie's comment, the river of life itself is now in danger, I think really it articulates the problem really fundamentally. We heard over and over again, we don't just need to hear platitudes, we need to hear plans. We need to have some meat on the bone from governments. And I think the most inspiring thing is we heard from everyone, even old people on the panel like me, that the future is in the hands of youth, and they're really taking this to heart. They're not tolerating nonsense and inaction anymore. So that is really hopeful. So I hope you've all left this session hopeful. As Eva noted at the start of the session, this dialogue will be followed by a separate but related session today at 1 p.m. You get a short bathroom break, and that session is going to be on Canada's National Agenda 2030 strategy and the factors influencing federal uptake of the SDGs. Hopefully everyone will be wearing Dr. Aruta's pin at that one, and they have another great lineup of panelists. So please take a little break, come back at 1 for that one. Please everyone stay safe, get vaccinated, and get your kids vaccinated, and do something today to make climate change a little lesser of an impact. Every little action matters. So thank you.
Thank you.